Thank you, Senator Johnson, and thank you to the great people of the UK and the Channel Islands. It's an honor to be here. I'm Dr. Ryan Cole. I'm a board-certified anatomic and clinical pathologist. I did my training at the Mayo Clinic. I did a year of surgical pathology as the chief fellow at the Mayo Clinic. I did a year as the chief fellow at Columbia University in dermatopathology. Did PhD research in immunology and virology, and I've seen 500,000 patients in my career. Ran an independent lab for 21 years. So, and yes, my career has been destroyed for speaking out, and I would do it all over again. I'm going to quickly go through what some of my colleagues have touched on. Okay, what do we know? Well, I have no conflicts of interest. We're unfortunately in an era of wealth and wellness and not in an era of health and wellness, so we need to change this. Synthetic DNA and modified RNA injections are not vaccines, never have been, never will be. They are genetic transfection agents and therapies. According to the filings of Moderna and Pfizer, they know this. We don't know the long-term consequences of these, and they're still being developed for hundreds of other conditions. It's not just these COVID shots. I know everybody has COVID fatigue. I understand that. What we need to do is stop this platform. It's not meant for human use. It's not ripe for human use. For a successful technology, reality must take precedence over public relations, for nature cannot be fooled. We are fooling ourselves and we're fooling nature. More injections, plain and simple, equals more infections due to immune suppression that Dr. Dalgleish covered. Cleveland Clinic showed this in a very straightforward study on their 50,000 employees. I'm not here to judge anyone that did or didn't get a shot. I'm just saying no more genetic shots, please. These are expired shots. These variants don't even exist, yet boosters continue to be pushed. You know, from day one, chasing a coronavirus with a vaccine was a scientific impossibility, always has been, always will be, because of the mutation rates of this family of viruses. Your body was turned into a factory for producing proteins. Human cells are meant to make human proteins, not foreign viral proteins. The cells don't lie. I'll show that. This is pathology. I'm not going to turn you into a pathologist in 7 minutes here, but I will show you what happens. That needle goes in the arm, vessels are broken, and then your cells start to produce this foreign protein. These brown dots, this is from my colleague, Dr. Burkhardt, the late great Dr. Burkhardt from Germany. These cells start to make this foreign protein. This is the toxic part of the virus, this spike protein. The lipid nanoparticles were known from day one to be dangerous. They accumulate all throughout the body. They don't stay in the arm. They go everywhere. This is from Japan, a FOIA study from Dr. Byron Bridle that he was able to obtain. They concentrate highest in the ovaries, which is highly concerning. The lipid nanoparticles themselves are not for human nor veterinary use, and yet they went into billions of people. As my colleague was mentioning, this synthetic mRNA, though Weissman received the Nobel Prize in that Zoom video, he lied. This is the mRNA. This is a study out of Stanford by Dr. Roltgen and colleagues. 60 days later, the synthetic mRNA was still persistent, still present, and still producing this foreign toxic protein. Dr. Brogna, as mentioned, showed that this spike protein from the injections was still circulating up to 6 months later. We still don't know how long. And in addition, excellent research out of Oxford and Cambridge showed that this synthetic RNA causes shifting, and it's not just producing spike protein, but it's making Frankenstein proteins. It's making other proteins that can trigger the immune system. The spike protein can deposit in the brain. This is a study from Dr. Merz out of Germany. This is one out of Dr. Burkhardt's lab. This is one out of my laboratory showing spike protein in peripheral nerves. Spike protein accumulates and actually reproduces very quickly in the liver and causes autoimmune diseases. Obviously, the heart damage will be addressed by my colleagues, but this is showing spike protein in the coronary vessels in the cardiac tissues. Spike protein is abundant within those tissues. And again, these shouldn't be in the human body. This is in the adrenal glands, important for so many physiologic functions of the human body. These are all things that should have been known and disclosed before it went into one human. That advanced aging, we know the spike protein binds to the elastic fibers of the skin. All these black streaks, those are the elastic fibers. These are being destroyed by the spike protein. We also know that spike protein from the injections accumulates in the placenta, in the uterine lining, and in the testicles within the gametes, the sperm. Causes other viruses to reactivate, alters the innate immune response. That's the Marines of your immune system. It makes them drunk and they go back to the barracks and they're not on the front lines fighting other infections as well. These are known to cause clotting. It inflames the lining of the blood vessels and induces some interesting clotting pathways. We'll have more papers coming out on that soon. Several increases in rupture of the biggest vessel in your body, the aorta, and forms unusual amyloid rubber clot-like proteins. I've been working with some analytical chemists. We're going to have a paper coming out in the next couple of months. I think we know exactly what's causing these fibrous clots now. Unfortunately, there's a high percentage of people forming microversions of these larger clots, which induces a lot of pathology. It's happening in the living, not just being found in the dead. These shots are causing a rise in your IgG4. Everybody hears about antibodies. This antibody is what I want on my farm. I'm a beekeeper, so I want to build up a tolerance to different proteins. You know, if I get stung, I don't want to hyperreact. You don't want to build up tolerance to pathogens in life, because then you're a sitting duck. You're a ship without a keel. Your immune system won't recognize future variants. This is critically important. So cancer, that's the big question. I have just a few seconds left. We know countless mechanisms already whereby these mRNA injections, this synthetic mRNA, can cause cancer promotion pathways. Turbocancer is just a colloquial term. Advanced progression of disease is the clinical term. You know, Dr. Dalgleish talked about it. It binds to an important tumor suppressor family of genes. This is a tumor. Every tumor cell in this particular cancer from the stomach is expressing spike protein. Here's a pancreatic cancer. Every single cell in this cancer is expressing spike protein. These are binding to these tumor family of genes and allowing them to move forward. Here's a patient on the left who had an aggressive lymphoma 3 weeks after a booster. On the right, you can see the aggressive nature of his tumor. And again, that's immune suppression amongst many other mechanisms. Here are the cancer trend rates. Just look at the line at the end on the right, and my time is up. So I'm going to just show you the trend lines, all going up. Great data out of the UK, except they're not reporting it anymore. And your disability data sets showed that by 2022, there was a 35% increase in claims for disability from cancer in your PIP UK disability clearances. These are the cancer death rates for 10 years running in ages 15 to 44. Look what happened in 21 and 22. At that, I will obviously run out of time, so I'm going to stop and open it up to any questions if there's time.
That's cool. Just one quick question. You know, obviously I was talking to doctors, medical researchers, even before the EUA was issued in December 2020. I wasn't going to get the shot. I mean, I'm not a medical professional myself, but there was enough known then that I wasn't going to subject myself to this experiment. Every month that's gone by, you know, the VAERS report starts coming out, but now the science keeps backing it up, more and more studies. The question I have for you is, why has all of this been ignored? Why has it been it's been impossible to get federal health officials globally, government health officials globally, to take a look at the science? We're supposed to follow science. Do you have an explanation for this?
Well, I do, and I would recommend everybody read Bobby Kennedy's new book, The Wuhan Cover-Up. One understands, I mean, the 77th Brigade in the UK was responsible for a psychological operation and a nudge operation on the people in the United States. The intelligence agencies were responsible, the Five Eyes Nation, New Zealand, Australia, Canada, US, UK. There was, from the top, a plan from the get-go. And if you go back to the Milken Institute, October 29th, 2019, Rick Bright and Anthony Fauci were in that meeting and they said, gosh, we hate that it takes so long to bring a vaccine to market. But if we had a pandemic, and gosh, say it came out of China, we could rapidly print mRNA new technology and emergency authorize this new product without all this research. So I think there are a lot of puzzle pieces that fall together. A lot of it was a psychological operation, but there are large powers that be that controlled the narrative. This is all basic science. I'm not political about this. This is simply science, and a lot of it was known science, and that's a great question. Your oversight letters, I think if they ever answer, we will find out the things they don't want us to know.
My recollection from that Rick Bright, Anthony Fauci panel at the Milken was they were just bemoaning the fact that we did not have a universal vaccination program, and it was going to take a pandemic to have one, and they got it and they pushed it. But thank Dr. Cole again. Thank you for your courage, and sorry to what's happened to your career. Let's move on.
It's an honor. Thank you, Senator.